Imagine waking up feeling sick but hesitating to seek medical care because you're worried about the cost. This is the reality for millions of people worldwide, forced to prioritize finances over health. In the class survey I conducted, 100% of you said that healthcare should be a right. 50% of you said that you have avoided medical care due to costs. Universal healthcare is essential because it ensures that everyone has access to necessary medical care, it promotes equality, and it reduces the financial burdens that medical expenses place on families. While preparing for the speech, I reviewed multiple sources, including the Lancet Global Health, the World Health Organization, the American Public Health Association, and the Commonwealth Fund. If you're interested in learning more, please visit the works cited slide on my attached PowerPoint. During this presentation, I will explore access to healthcare is essential for individuals to live healthy lives, universal healthcare promotes equality, and universal healthcare reduces financial burdens on families. Healthcare is the foundation of a thriving society, ensuring that individuals can lead productive, fulfilling lives without the constant fear of illness or financial ruin. Healthcare is a basic need that everyone deserves. As the World Health Organization states, universal healthcare is firmly based on the 1948 World Health Organization Constitution, which declares health a fundamental human right and commits to ensuring the highest attainable level of health for all. This means that everyone should have access to the best possible care, no matter their situation. Without access to medical care, preventable diseases often go untreated, and minor health concerns can escalate into life-threatening conditions. These gaps in care lead to widespread suffering, economic instability, and deepening health inequities across communities. Compared to countries that have universal healthcare systems, the U.S. has much lower life expectancy rates and higher mortality rates. The U.S. faces significant healthcare challenges that negatively impact public health and well-being. A study from the Commonwealth Fund shows that the U.S. has the lowest life expectancy at birth, the highest death rates for avoidable or treatable conditions, the highest maternal and infant mortality, and among the highest suicide rates. These alarming statistics highlight the urgent need for healthcare reforms that ensure accessible, affordable, and effective medical care for all citizens. Without actions, these issues will continue to affect individuals and families across the nation. Now that I've spoken about how access to healthcare is essential for individuals to live healthy lives, I will discuss how universal healthcare promotes equality. Unequal hospital funding limits resources for low-income communities, worsening healthcare disparities, and highlighting the need for policy reform. Funding disparities in the U.S. healthcare system create significant inequities, particularly for hospitals serving low-income communities. As the American Public Health Association outlines, hospitals reimbursed mostly by Medicaid and Medicare received far less federal funding from the March 2020 CARES Act and the Paycheck Protection Program and Healthcare Enhancement Act than hospitals mostly reimbursed by private insurance. Therefore, hospitals that primarily serve low-income patients received a disproportionately smaller share of total federal funding. This unequal allocation of resources leaves financially struggling hospitals with fewer funds to provide adequate care, deepening healthcare inequalities and making it harder for vulnerable populations to access necessary medical services. Addressing these imbalances is essential to ensuring that all hospitals receive fair funding and that healthcare access is not determined by economic status. Hospitals that serve low-income communities struggle to provide good care because they get less funding. With fewer resources, they face staff shortages, outdated equipment, and limited treatment options, making the healthcare gap worse. To fix this, policies need to ensure fair funding so everyone can get the care they need, no matter their income. Ensuring equal access to healthcare is essential for protecting public health. reducing disparities, and upholding the right to medical care for all. Healthcare inequities remain a critical issue, preventing many communities from receiving the essential medical services they need. As the Lancet Global Health Journal emphasizes, inequity is one of the greatest challenges of our times. When entire population groups cannot access essential health services, including prevention and response services in times of crisis, we are not protecting and delivering on the right to health. Ensuring equal access to healthcare is not only a moral obligation, but also a necessary step toward building a healthier and more just society. Without actions, these disparities will continue to harm the most vulnerable populations, exacerbating existing health challenges and widening the gap in medical care. Fixing healthcare inequality means making sure everyone gets the medical care they need, no matter their income or background. Without fair access, poor communities suffer more from preventable diseases and lack proper treatment in emergencies. Fair healthcare keeps people healthier, reduces suffering, and ensures that medical care is a basic right for all. Now that I've spoken about how universal healthcare promotes equality, I will discuss how universal healthcare reduces financial burdens on families. Universal healthcare protects families from financial hardship, promotes stability, and ensures access to essential medical care for all. The financial burden of healthcare can be devastating, forcing individuals and families to make impossible choices between medical treatment or financial stability. As the World Health Organization emphasizes, protecting people from the financial consequences of paying for health services out of their own pocket reduces the risk that people will be pushed into poverty because the cost of needed services and treatments requires them to use up their life savings, sell assets, or borrow, destroying their futures and often those of their children. By ensuring access to affordable health care, societies can safeguard economic security, prevent unnecessary financial distress, and promote a healthier, more stable future for all. Universal healthcare helps people avoid crushing medical debt and leads to a stronger, more stable society. When healthcare is affordable, people stay healthier, work more, and contribute to their communities. Families can focus on their future instead of worrying about expensive treatments. Making healthcare a right ensures that everyone gets the care they need, creating a more fair and more secure system for all. Limited long-term care coverage in the U.S. forces many to face overwhelming costs, highlighting the need for expanded insurance options. The lack of comprehensive coverage for long-term care in the U.S. leaves many vulnerable individuals struggling to afford essential services. As the American Public Health Association highlights, our healthcare system insufficiently covers vulnerable groups. About 14 million U.S. adults needed long-term care in 2018. Medicare, employer-based insurance, and the ACA do not cover home and community-based long-term care. Only private long-term care insurance and patchwork systems for Medicaid-eligible recipients cover such assistance. For those paying out of pocket, estimated home care services average $51,480 to $52,624 per year, with adult day services at more than $19,500 per year. These high costs place an immense financial burden on individuals and families, making long-term care inaccessible for many. Addressing this gap in coverage is crucial to ensuring that all people, regardless of income or insurance status, receive the support they need as they age or face chronic health conditions. Without good insurance, many people either spend all their savings or go without the long-term care they need. This makes financial and health problems worse. Expanding insurance to cover home and community care would help aging adults and those with chronic conditions get support without the huge costs. Everyone deserves care that lets them live with dignity and a good quality of life. To sum it all up, universal healthcare is essential because it ensures that everyone has access to necessary medical care. It promotes equality, and it reduces the financial burden that medical expenses place on families. Universal health care guarantees that every person, regardless of their background, has access to essential medical service. It promotes fairness by ensuring that health is treated as a human right rather than a privilege reserved for the wealthy. If we truly believe that health is a human right, then now is the time to act and build a system that prioritizes people over profits. So I ask you, has your perspective changed? Have you become more for or against universal health care? And most importantly, will we take action now or continue to let millions struggle without the care they deserve? No one should have to choose between their health and financial stability. Investing in universal health care is not just an act of compassion. It is a step toward a future where no one suffers due to lack of care. Let us work together to ensure that healthcare is recognized as a right, not a privilege.